Welcome back from the break. I'm Uday Pratap Singh. You're joining us on NewsX. Our big focus this hour remains on the Omicron wave. As the Omicron wave takes over the world, countries are facing a race against time to tackle this new variant. Guidelines and protocols are changing by the day as nations combat rising COVID cases. In revised guidelines, the Ministry of Home and Family Welfare has revised India's COVID-19 guidelines. According to the new rules, patients testing positive can be considered fully recovered after 10 days of the onset of symptoms. A negative RT-PCR is not mandatory for discharge. However, questions loom: when is one fully recovered? Do negative home tests suffice? How long does it take for asymptomatic patients to recover? Once recovered, is it safe to venture out without a mask? Is it possible to get reinfected by Omicron? Well, if you also have questions, you can call us on the numbers flashing at the bottom of your screen. We will be taking your calls live. We will get our panel of expert doctors to answer your questions on the program. Joining us at this point is Padma Shri Dr. Sanjeev Bagai, Chairman and MD Nephron. We also have Padma Shri Dr. Mohsin Wali, cardiologist and physician, joining us live. Also with us is Dr. D.K. Gupta, CMD Felix Hospital. Okay, well, we have Dr. D.K. Gupta, in fact, joining us live at this point. Dr. D.K. Gupta, just inform our viewers about the new recovery protocols of this new variant. This new variant has new symptoms. It also has, of course, a new gestation period. So what are the new recovery protocols, the new testing protocols with regards to this variant, and after how long can people be safe to venture out?
I think this is a great question. I would like to know that the incubation period or gestation period is 2 to 5 days average. And normally it can extend up to 14 days. Means if you got infected, you can be asymptomatic up to 40 days also. And 90% of people can be symptomatic within 5 to 7 days only. So like if you are asymptomatic also, then you can be infected and you can transmit the infection. That is one point. Second point, if you are already infected and your result is positive, either it is RT-PCR or it's a red test, both positive, any of these tests positive is considered as positive, and it means you need to be in isolation for minimum 7 to 10 days, ideally 7 days. And if symptoms are persisting, then you need not to move out. Then you have to be fully recovered. At least 7 days after recovery, you can go out.
Okay, and in fact, Dr. D.K. Gupta, there are many other questions as well. Do negative home tests suffice? Or if someone has tested negative and they still have symptoms, should they get an RT-PCR test? What is the testing protocol that you would like to advise us?
Very good question. If you are having influenza-like symptoms like cough, cold, sore throat, and dryness in mouth or fatigue, fever, these are all influenza-like illness. And if these are there, then it is proven that you are most probably COVID patient until and unless ruled otherwise. Means you can go for the screening test, that is antigen test. If it is negative, then you have to go for RT-PCR again. If it is positive, then you are positive, you need not to do RT-PCR. And if it is negative, then you have to do RT-PCR. RT-PCR can come positive or negative. If it is positive, then you are positive and you have to go in isolation and get the treatment. If it is negative and you are still symptomatic, you should consider repeat RT-PCR test with the advice of your doctor. Means sometimes 30% RT-PCR test can be negative because of several steps in that process of RT-PCR. Means it can be, there can be inaccurate sample collection, or sample collection process was not good, or there can be contamination of sample or reporting error also. It means if you are symptomatic, then repeat RT-PCR test can be done because of 30% false negative test also. Still, it is positive or negative, depends upon that, then it can go. If you are still negative again, and you are symptomatic, then you should be in quarantine and you should use all COVID approved behavior till you are asymptomatic. You can move out from your home only if you are asymptomatic, at least 5 to 7 days after that.
Right. Dr. D.K. Gupta, stay with us. In fact, let's play out now a ground report coming in on the corona situation.
Telangana has reported 1,920 COVID positive cases in the past 24 hours, with 2 deaths due to COVID in the state. Whereas Andhra Pradesh has recorded 1,831 COVID positive cases and no deaths due to COVID in the past 24 hours in the state of Andhra Pradesh. Telangana has, however, not imposed any special restrictions like night curfew or weekend curfew, but has prohibited mass gatherings and public rallies in the state till the next upcoming days. The state has closed educational institutions till January 16th. Now that festivities have come, no special restrictions have been announced by the state government in Telangana. Whereas Andhra Pradesh has imposed a night curfew till yesterday, but due to festivities it has been postponed, and the new fresh orders have been issued that the night curfew will start from the 18th of January till 31st from 11 p.m. to 5 a.m. In the state of Andhra Pradesh. However, in indoor gatherings of more than 100 are not allowed, whereas outdoor gatherings of more than 200 people are not allowed in the state. The theatres are functioning with 50% capacity as stated by the state government in Andhra Pradesh. With Vijay Vasif, Abdul Bashir, Hyderabad.
And let me go back to Dr. Gupta. Dr. Gupta, if we talk, of course, now about asymptomatic patients, we spoke about symptomatic ones, but if we talk about asymptomatic patients, how long does it take for them to recover?
Normally, asymptomatic patients also need to require at least 7 days at home so that they can be recovered, but we do not know what will be having post-COVID effect in asymptomatic patients also. COVID virus affect your multi-organs like liver, kidney, lungs, heart, etc. It means post-COVID symptoms can persist after 7-10 days also in asymptomatic patients. Therefore, I think whatever your doctor is advising, follow all those medications at least and try mild exercises, take plenty of fluids. After recovery also, take antioxidants and have healthy lifestyle after post-recovery also. Hello. Am I audible?
Dr. Gupta, yes, yes, of course you are. I also would like to ask you, can you hear me, Dr. Gupta?
Yes, please.
Okay, yes, you can hear me now. Yeah, okay. Dr. Gupta, also I would like to ask you on reinfection. Can people be reinfected with this Omicron variant? Or, is reinfection not possible? Because a lot of people after recovering would, venture out without a mask, etc. Is that foolish?
I think that is a great question. Most of people thinking that if they are infected with Omicron, even Delta, they cannot be reinfected. That is false. Significant percentage of patients can be reinfected. We have seen in Delta also, Alpha also, and Beta also. It is not a permanent immunity given by the natural infections also. Means one-time Omicron infection or Delta infection cannot give you permanent immunity against preventing the reinfection. Definitely, there will be some sort of antibodies. They can prevent severe disease, but reinfection is possible with Omicron also.
All right, Dr. Gupta, stay with us. In fact, we have another ground report now coming in. Let's play that out.
मुंबई सहित पूरे महाराष्ट्र में इस वक्त धारा 44 लगाई गई है दिन में, और रात में कर्फ्यू लगा दिया गया ताकि भारी संख्या में लोग कहीं पर इकट्ठा ना हो, ताकि कोरोना का जो बड़ा कहर इस वक्त पूरे महाराष्ट्र में खासतौर से बरपा है, क्योंकि देश में जो सबसे अधिक कोरोना के केसेस मिल रहे हैं तो मुंबई और महाराष्ट्र में मिल रहे हैं, और इसे कहीं कंट्रोल करने के लिए महाराष्ट्र सरकार ने कई सारी बड़ी पाबंदियां लगाई हैं। लेकिन पाबंदियां दिखाने के लिए हम आपको ले आया हूँ मुंबई गेटवे ऑफ इंडिया, जो कि एक प्रसिद्ध जगह है। इस जगह पर भारी संख्या में लोग आते हैं। आप तस्वीरों के माध्यम से देखकर समझ सकते हैं कि किस तरीके की पाबंदी, किस तरीके के नियम यहाँ पर मुंबई महानगर पालिका की तरफ से साफ साफ कहा गया है। सरकार ने साफ साफ कहा है कि तमाम उन जगहों पर लोग एक साथ 4 से 5 लोग से अधिक इकट्ठा नहीं हो सकते, यानी धारा 44 लगाई गई है। उसके अलावा रात में नाइट कर्फ्यू लगाया गया है। लेकिन ये तस्वीरें देखकर आप समझिए किस तरीके से तमाम नियमों का पालन कैसे हो रहा है आखिरकार, क्योंकि भारी भीड़ यहाँ पर है और इस भीड़ को ही यह बताता है कि किस तरीके से जो ओमिक्रॉन का कहर है, कैसे और अन्य जो डेल्टा प्लस के हैं या फिर जो अन्य वेरिएंट हैं कोरोना के, वो कैसे लोगों के बीच में पसर रहे हैं, कैसे वो लगातार उसका तमाम लोगों के बीच में लगातार वो बढ़ता जा रहा है। कारण यही साफ है कि लोग जो हैं वो मानने को तैयार नहीं हैं, तमाम जगहों पर भीड़ करते हैं। और इसमें से अधिकांश लोग आपको दिखेंगे जो मास्क नहीं लगाए हैं, अधिकांश लोग आपको ऐसे दिखेंगे जो तमाम नियमों का पालन नहीं कर रहे हैं। गेटवे ऑफ इंडिया चूंकि काफ़ी प्रसिद्ध और मशहूर जगह है, ठीक सामने ताज होटल आप देख रहे हैं, गेटवे ऑफ इंडिया देख रहे हैं, यहाँ पे बोट चला करती हैं, उस बोट में भी तमाम लोग सवारी करते हैं और यहाँ पर हर चीज़ को जरूर अगर कोई ध्यान में रखे तो तमाम जो नियम का पालन अगर करे तो जो कोरोना का प्रसार हो रहा है खासतौर से वह नहीं होगा। अब देखिए बोटें भी यहाँ पर चल रही हैं और नियम, खासतौर से जो नियम है वह नियम का पालन नहीं किया जा रहा है। यह अपने आप में बड़ी चीज दिखाई पड़ रही है यहाँ पर। और गेट ऑफ इंडिया की तस्वीर आप देख रहे हैं किस तरीके से खास तौर से अगर हम कहें यहाँ पर भीड़ आपको दिखाई पड़ेगी और जो नियम बनाए गए हैं, सरकार कहती है कि तमाम उन जगहों पर 4 से 5 लोग अधिक इकट्ठा ना हो, यानी दिन में भी धारा 144 लगाई गई है, रात में नाइट कर्फ्यू लगाया गया है। लेकिन ये तस्वीर देखकर कौन कहेगा कि दिन में भी धारा 144 लगाई गई है और अगर लगाई गई है तो उसका पालन क्यों नहीं यहाँ पर हो रहा है। कैमरा प्रमोद के साथ अभिषेक शर्मा, इंडिया न्यूज।
We have Dr. Sanjeev Bagai also joining us at this point now on the program. Dr. Bagai, we are of course talking about this new variant. With this new variant, there are new recovery protocols, aren't there? It's obviously important to educate our viewers on those. There are new gestation periods for this new variant. Also, the recovery protocol has changed. The home quarantine protocol has changed, Dr. Bagai. Do we have Dr. Bagai with us? I think he's on mute.
Am I audible?
Yeah.
Yes,
please.
So the latest publications and literature of specifically for Omicron states that you are at your infectious most. That means your viral load in terms of RNA replication is maximum on day 3 to day 6. Between day 6 and day 8, it decreases, but you are still liable to be infectious till day 10. There is no live viron which is replicating or can be picked up either in the nasal swab or your pharyngeal swab after day 10. So my own request and suggestion to everyone is strict isolation for 7 days as a bare minimum, but keep at home for the next 3 days, but with a mask. You only step out of the house after day 10 if it is something urgent. It's important to keep in mind that you can still be infectious after day 6 to day 7. Although lesser, your maximum peak of infecting others in terms of transmissibility is day 3 to day 6.
Okay, which is why, of course, people need to keep this in mind, as you're saying, Dr. Bagai, before stepping out while, of course, they're isolating at home. Now, let's just talk a bit about the home tests. How reliable are these? Because we're seeing with this new variant, they're being used a lot because they're freely available in the market.
Is that for me?
Yes.
Yeah. So the home tests are not of the same generation of what we saw, a year and a half back. So very quickly to put into place, there are basically 2 types of tests. One is what we call as a RT-PCR, which is taken as a gold standard. And now the rapid antigen test is what has actually taken over for mass screening. Now this test, which we call as a lateral flow rapid antigen test, is giving you more than 95 to 98% sensitivity and specificity across all variants and across all CT values, what we call as cycle threshold values. So it is extremely good, it is sensitive, it is specific, it gives you a report within 30 minutes or 40 minutes, and it's extremely cost effective. Just a few hundred rupees versus maybe 2 or 3 times more would be the cost of an RT-PCR. But the real advantage of this is that it can pick up a patient who's a potential carrier, who's at his infectious most. That means about a day before RT-PCR is showing positivity. So it's an extremely useful tool. It should be used. In fact, in UK and in US, all children are being randomly tested twice a week with a RAT. So that's the protocol, because you tend to then pick up cases. We've also seen that 68% of admissions can be avoided if you use rapid antigen tests in a judicious manner alongside with RT-PCR, depending upon which cohort you're screening or diagnosing.
Okay. Of course, as far as asymptomatic and symptomatic patients are concerned, Dr. Bagai, is there a difference in the treatment procedure, in the recovery procedure?
Yeah, so the tricky part of the entire group is actually the asymptomatics. Now we know that all the variants, all put together in meta-analysis, about 35 to 38% of patients internationally, globally, are asymptomatic. But the real clue lies is in Indian setting is the largest percentage of Indian population is the pediatric population. 49.5% of children below the age of 18 are asymptomatic or polysymptomatic. Now, these are the children who can carry the same viral load as adults. They can transmit as much as adults, and they can be the number one cause of transmitting what we call as household transmission. So it's important to identify the asymptomatics. Now, the asymptomatics may just have a very subtle body pain or just a day or half a day of fever or maybe little irritation in the throat. So really the carry home message is, if you have any symptoms vis-a-vis sore throat, scratchy throat, runny nose, blocked nose, cough, fever with or without fever, body ache, headache, please consult your local doctor and get it tested. If you can catch a patient in the first 1 or 2 days of the onset of symptoms, or what we call as the prodrome phase, we can stop the transmission with quick isolation.
All right. Well, okay. Dr. D.K. Gupta, let me in fact draw you in here quickly as well. Dr. D.K. Gupta, obviously it's very important to educate and sensitize the public about these new procedures, because there's a lot of confusion, isn't there, on the recovery protocol, the treatment protocol, because earlier a lot of people, of course, got a bit confused by that first advisory which said after 7 days you can, begin to move out of your house. And also, there is an advisory on testing as well, which said that, we don't need to test all asymptomatic contacts of COVID positive patients, just ones with symptoms.
I think it depends upon about our logistics and the capacity to do testing also. We know that because of peak, there is a lot of loads on the lab for the diagnostic of testing of these RT-PCR and antigen tests. Therefore, guidelines are revised depending upon the virus load, depending on the stage of transmission. It is community transmission or household transmission. We know that currently we are in community transmission, and there is much COVID-approved behavior is the only process. From that, we can stop this chain of transmission. And for that, if you are asymptomatic, there is no symptom, and if you come in across the contact of any positive patient or your caregiver, so they need not to do test if you are like healthy or you are not comorbid. If he is comorbid, like more than 60 or having any hypertension, diabetes or asthma, COPD, dialysis patient, transplant patient, they need to do tests also if they are in close contact with any positive patient. But a healthy patient need not to do tests if he is having no symptoms. But as Dr. Sanjeev told, symptoms can be very vague. Like if you are having fatigue, this is a one most common symptom. Second, if you are having mild body ache or headache, slight sore throat, slight cold, coughing, running nose, sneezing, these symptoms, these all are coming in the umbrella of ILI, that is influenza-like illness. Any two of these symptoms can be COVID positive patient. Therefore, if you are having any of these vague symptoms also, go for testing, and if it is positive, go for the isolation, so that we can stop the chain of transmission, and that will help in the reducing the positivity rate also and chain of transmission also.
All right. Appreciate you joining us, Dr. Gupta and Dr.